Welcome to an episode of Paging SUMC, a series where we bridge the gap between our healthcare workers and the public by showcasing SUMC services, facilities, as well as highlighting the work of our SUMC healthcare specialists. Today, I'm here with our cardiac rehabilitation expert, Dr. Revi N. Nwiko Jr., and today we will be discussing about cardiac rehabilitation in this episode entitled Life After Heartache. Doc, good morning. Thank you so much for sitting with us here today.
Good morning. Good morning, everyone.
So, Doc, to kick things off, I would just like to congratulate you on your milestones because first, you are the first cardiac rehabilitation unit here in Negros Oriental. And aside from that, you've also just turned 1 month old in the unit, if I'm not mistaken. So,
Yes.
I would just like to ask first, Doc, how do you feel about these milestones?
Well, I'm quite honored and very excited to be the one to introduce cardiac rehabilitation to Negros Oriental, as this is a relatively new and underappreciated field in cardiology. So, by definition, cardiac rehabilitation is a medically supervised program which is multidisciplinary in its approach aimed to enhance secondary risk prevention. So, this is a program that is holistic. It includes patient evaluation and initial assessment. It involves identification of risk factors that should be addressed, including nutrition, weight control. It includes other risk factors like diabetes, hypertension, and also psychosocial well-being. So this all aims to make a holistic program that's not just an exercise program. So this separates it from a regular exercise or a gym exercise. So also the patients are monitored in cardiac rehab.
So thank you very much for that, Doc, by defining what cardiac rehab is, because I was also going to ask what is its difference from regular exercise, because the public has this notion that it is somewhat similar to regular exercise, particularly with what you said, the structured fitness program, Doc. But in here, you've said that it's much more holistic, or it's more than that.
Yeah. So we have to understand that with regular exercise, you can just start with a gym program, regardless of how the patient might be. I mean, regardless of how fit the patient may be. And it's also different for each person, right?
Yes, Doc.
But for a cardiac rehab program, you have to remember that this is for patients with cardiac disease already. So these are patients who might have been previously fit or who might have not exercised at all, but who needs secondary lifestyle interventions in order to prevent the recurrence of cardiac disease. So you do have patients who may be athletic, and then they want to get back to what they are capable of, but then they are anxious about going at it again because of the event. So cardiac rehab serves to guide the patient to get back to their normal activities with a structured, monitored exercise. So patients actually get attached to telemeters so that, because we know that at the start of physical activity, especially with a recent cardiac injury, they are at risk for developing fatal arrhythmias or sudden death. So we have to remember that if the patient has hypokinesia already or weakness in the ventricular walls, they have a 20% chance of dying from a fatal arrhythmia. And having a monitored structured exercise reassures the patient that they can safely get back to where they've been. And for patients who haven't exercised before, it can also kind of prompt them to move more. A lot of patients actually say that they have not exercised in their entire lives up until the start of cardiac rehabilitation, which is a good thing because we have to initiate change in a patient in order to prevent heart disease and prevent the recurrence of heart disease rather.
So that's very true, Doc, no? That, what you've said, in cardiac rehabilitation, what we are also trying to prevent is the recurrence of their diseases. So with what you said, Doc, this would also tailor to those patients who've undergone surgeries, operations with regards to their cardiovascular health. Am I correct on that regard, Doc?
Oh, yes. So cardiac rehab is actually perfect for patients, not only for patients who have undergone a heart attack, whether they've been revascularized, because we do cater to patients who have not been revascularized but have heart failure. It can also cater for patients who've had heart attack but have had a bypass graft or a PCI, a percutaneous coronary intervention with stent insertion. We also cater to patients who've had surgeries for valvular problems or valvular disease and congenital anomalies as well. So we also cater actually to patients with peripheral arterial occlusive disease. So a lot of patients can benefit from cardiac rehab, and we have programs in the unit for those kinds of patients.
So speaking of programs, Doc, if I'm not mistaken, that cardiac rehab entails phases. If I'm not mistaken, we have phase 1, phase 2, and phase 3.
Yes.
Could you explain it to us more? Because I'm also with the other people when they said that they really couldn't get the grasp of these phases, like for how long or what activities would entail. So could you enlighten us on this matter, Doc?
Okay, so when you say phase 1 cardiac rehabilitation, this is the initial phase in which we start cardiac rehabilitation while the patient is still confined in the hospital. So we usually start this at least 48 hours after a heart attack, or at least 24 hours after a percutaneous coronary intervention, or at least 2 or 3 days after a bypass graft. This is usually done every day during the admission, as this will be the initial phase in which we will watch for any arrhythmias or any ischemic changes while the patient starts moving. So this is an important phase in that there will be monitoring of the patients. It will give them confidence as they start moving again after a cardiac injury.
So from what I've read po, Doc, is that PhilHealth only covers for 6 sessions. But correct me if I'm wrong, is that phase 1 doesn't just last up to 6 sessions, right? It would last as much as it is needed.
So actually, PhilHealth covers phase 1 cardiac rehab for a minimum of 6 sessions. It doesn't say it's going to stop at 6. So for as long as the patient is still admitted, PhilHealth has a budget for that, which is around 66,104 pesos, which I think is enough to cover for more than just 6 sessions.
Okay, if I'm not mistaken, Doc, okay, that also includes not just the fee for the actual fitness program, but also as well as consultations, medicines. But we'll have to look on that on a different angle too. So, Doc, you've mentioned that phase 1 covers those patients who are admitted in hospital or hospitalized. So, once they've moved past phase 1, am I correct? They would be endorsed to phase 2. Am I correct in that regard, Doc?
So yes, once the patient is discharged, I would strongly recommend that they undergo phase 2 cardiac rehabilitation. And this is because phase 2 cardiac rehab is a crucial part of cardiac rehab in which we already let the patient do more activities in the cardiac rehab unit, and as well as observing how they do with their usual activities at home. So it's not just about doing exercises in the cardiac rehab unit. We also prescribe certain exercises and movement that they can do at home, alternating. So during phase 2 cardiac rehab, this is the perfect time for the patient to learn more also about secondary risk prevention as they become more receptive to new information, as they are no longer as anxious or depressed as they were when they were admitted. With phase 2 cardiac rehab, we also have stress tests. So we do treadmill stress tests to get the functional capacity of the patient. And this will definitely allow us to scientifically measure and get recommendations, proper recommendations for the patients as to what activities they can exactly do. So just because they've had a heart disease, it doesn't mean that they can no longer jog, they can no longer do pickleball or things like that.
I guess that's true, Doc, in that others would see it that after having a heart surgery or cardiac operation, is that they would be giving themselves or self-prescribe rather themselves with either a life or death sentence. Like, for example, like since I've just overcome this operation, like I could do more things than ever, I feel more alive, while others, they would just shy away from doing those things, like, or limiting their mobility in that aspect, Doc, no? And that regard, Doc, I would also just like to ask, how is the patient's initial response when they are endorsed or referred to cardiac rehabilitation? Are they happy? Are they anxious? Are they worried?
So of course, I think the most common response for the patient as of now is that they'd be wondering what is cardiac rehab. And so we have to explain to them the purpose. We have to explain to them the benefits of cardiac rehabilitation. And then once they're into it already, they also have this anxiety in which they'd probably ask themselves, but can I actually use the treadmill? Am I ready to do this? But of course, our role as physicians, as cardiac rehab specialists, is of course to reassure the patient that they can do better than what they're doing at the room. So some patients are even afraid to just walk around the room. But then, of course, we start with low intensity exercises. So we can actually let them do cycling already in the room. We can let them walk around the room while observing them for any arrhythmias. And eventually, we can progress in bringing the patient to the cardiac rehabilitation unit where they can do more exercises, more than just range of motion exercises, more than just stretching or walking around a certain distance. They can eventually do calisthenic exercises. They can even have weights. So these might surprise some patients, but at the same time, this will eventually give them the confidence to do more.
That's actually what's important, Doc, right? Is that helping the patients get back on track or towards recovery in that aspect. You've mentioned, Doc, that patients would be referred to cardiac rehabilitation unit once once they've met certain criteria rather, or eligibility requirements, Doc. So please correct me if I'm wrong, Doc, but phase 1, that would mean that the patient is still inside the room or for limited movement. Then once they've been referred or endorsed to phase 2, that's the time they could proceed to do activities in the cardiac rehab unit?
No, not necessarily.
Mm-mm.
So we have to remember that each exercise training program should be tailored to each individual patient. So each patient is different. Some patients might have been more physically active or might have been athletic even before the cardiac event, while some patients might have been frail or frailer. So what they can do during phase 1 cardiac rehab varies vastly. So some patients, we have to start slow. We have to start with low intensity exercises, as I mentioned, and then maybe keep them in the room or with low intensity exercises for the entire duration of phase 1 cardiac rehab. But some patients who are more active can already be brought to the cardiac rehab unit as early as the 3rd session of phase 1 cardiac rehab. So we've had a lot of, actually most of our patients in phase 1 cardiac rehab have been brought to the cardiac rehab unit after the 3rd session.
Okay, I understand, Doc, that in phase 1, if correct me if I'm wrong, is that we're also considering their MET levels or ADLs as well.
Yes.
In that phase 1, I've read that it is around 1.5 metabolic equivalent of a task, and that the ADL focuses or emphasizes more on self-care.
This is again not a correct notion because each patient has different capabilities, especially before the cardiac injury. So, and also it's affected by the level of injury that they've had. No, so some patients might be able to do more. I've rarely encountered a patient who starts with a 1.5 METs. They usually start with 2 or more. So we have a structured guide for activities, in which we have a range of METs with corresponding activities that they can do. So a lot of times patients start with activities for 2 to 3 METs. Okay, so it's very rarely that we have patients who are not able to do more than 1 MET.
Okay, thank you so much for that clarification, Doc, so that our viewers also would know what's the difference, or they would have an idea rather on what to expect from these phases. You've mentioned earlier, Doc, that one of the biggest issues that cardiac rehab faces is that awareness, or like if patients know, or like what I said, what do they know about cardiac rehab, what it entails, what is its scope, or what to expect from it. So I would just like to ask, Doc, what are some other issues that this department faces, and what are some ways that we can help address it?
Okay, that's actually a very good question. So there are a lot of barriers to cardiac rehabilitation, and I think First of all, the word rehabilitation might be intimidating to some patients. The word rehabilitation might entail something like a program for a very severe disease. Worse, some associate it with drug use, rehabilitation, right? Especially here in the Philippines. And we have more or bigger barriers to cardiac rehab than this. So one big barrier to cardiac rehab, and it's not just here in Dumaguete City, but it's actually observed across all units in the Philippines and even internationally. The biggest barrier would have to be physician referral. So not a lot of physicians are also as aware as to what cardiac rehabilitation is. So even if they have patients who are already eligible for cardiac rehab, they don't bother referring the patient for cardiac rehab. And another main issue is, of course, finances. So there is always a cost to cardiac rehab as well. And I don't think any private institution or any unit can function without considering costs. But the good news about this is that we already have, again, the PhilHealth AMI program, especially for patients who've had a heart attack. PhilHealth can already cover for cardiac rehabilitation for a minimum of 6 sessions during phase 1. We are still working into including phase 2 cardiac rehab in PhilHealth as well. And as of our last heart failure caravan, we are also lobbying for inclusion of heart failure patients in cardiac rehabilitation coverage.
Alright, so thank you very much for that comprehensive answer, Doc. Like what you said, the general public also has this tendency to fixate on the term rehabilitation, aside from considering the whole terminology cardiac rehabilitation, in that they would associate it with rehabilitation from drug use. And it's also good. I think it's a very good news to our audiences that you're also lobbying for the inclusion of phase 2 in the PhilHealth coverage. I think it also coincides with your goal at Philippine Heart Association Negros Oriental chapter, in that you would like to address issues at the grassroots level. So I really commend that, Doc. I've also remembered, Doc, that as of now, we've only covered phase 1 and phase 2. So I would also like to ask about phase 3, Doc. We couldn't really forget about phase 3.
Okay, so you might be wondering, what is the purpose of phase 3 cardiac rehabilitation, since this phase is also done as an outpatient.
Mm-hmm.
So a lot of times you have patients with, for example, heart failure who have not really recovered after phase 2. So phase 3 serves as an extension almost of phase 2, in which those patients might still continue cardiorespiratory exercise training that is supervised. So a lot of these patients are not even confident yet to go back into their regular physical activity and their regular leisurely activities like sports. So this caters to those subset of patients. And from my experience, we've had patients who even finished phase 3 and still enrolled in a maintenance phase.
So that's very good news, Doc, no? Because I've also heard there were some issues circling around that other patients, they would refrain from going on to phase 2 or phase 3, that they would only finish up to phase 1. So how do you address that, Doc? Like, how do you reinforce the importance of this to them, to those patients who are hesitant, rather?
Okay. So I think the biggest barrier still about phase 2 cardiac rehab is still money. So financial difficulties will still be a hindrance for phase 2 cardiac rehabilitation. As we mentioned, it's not yet covered by PhilHealth as of now, but we do help patients in a lot of ways. Not only do we explain to them the benefits of phase 2 cardiac rehabilitation, but I have been personally giving them like medical certificates to aid with government assistance. And we've had one patient who actually was assisted for all 36 sessions free by the government of Siquijor. So we are also appealing to a lot of organizations and maybe to some politicians to assist patients in need, as this is not yet covered in PhilHealth.
I can really see their hesitation, Doc, with regards to that, because money really isn't a light issue or something to be laughed about. And I really laud how you're also very going out of your way, kumbaga, in assisting our patients in getting the financial assistance needed to continue on with their cardiac rehabilitation. Because what we really aim here is not just to just for the sake that they would have these sessions or tests or whatever it is that it entails, or assessments rather. But what we are also aiming here is for the patients to get back on track, like what I
Yes.
keep on stating for a while now.
So I think another major barrier that I forgot to mention is that distance. Was always a barrier. So we've had a lot of patients who've had bypass grafts done in Manila or Cebu, or who've had a percutaneous coronary intervention done also in Cebu, but then they would find it more bothersome to do cardiac rehab in a faraway place, because if you think about it, if they're not really from Cebu or Manila, they have to pay for rent, they have to pay for airfare, they have to pay for their food there and whatnot, like taxi rides, grab rides. Whereas now that this is already available in Dumaguete City, Negros Oriental, patients can opt to have their cardiac rehabilitation here and save more. So that's another important barrier that this unit can address.
So for this year's theme, Doc, sa 30th Annual Convention sa CARESP, or our Cardiac Rehabilitation Society of the Philippines, their theme for this year is Cardiac Rehabilitation in the Modern Era, optimizing recovery and reducing recurrence. So I'd just like to ask, what is its significance to you as a healthcare professional? Like, what does it mean? And what does it also mean for our patients?
All right. So as with any convention, this serves as a means for us to be updated on the current practices and knowledge on the field of cardiac rehabilitation. So this will include practices such as the benefits of the cardiovascular benefits of GLP-1 receptor antagonists, cardiac rehabilitation in frail and elderly people, also cardiac rehabilitation in patients, for example, with arrhythmias and with devices such as pacemakers and ICDs. So these are things that are not frequently tackled, but definitely if we have these knowledge, then it will optimize secondary risk prevention in patients. And overall, it will still benefit the patients and improve their quality of life.
That's very true, Doc, and I'll also like to commend you on that. And that advancements really in medicine would really improve the quality of life as well as quality of healthcare that we provide to our patients here at SUMC. So I'd just like to also insert a question, Doc, because I've also been asked by my friends and relatives, like, and they would also like to know if ever a patient has undergone cardiac rehab, how soon can they go back to driving?
Oh, okay. So it depends on the case. For example, if a patient has an acute coronary syndrome or a heart attack, so to speak, with an ejection fraction that is more than 40% and who has undergone PCI or stenting, then the patient may go back to driving after 2 weeks. But if the patient has an ejection fraction of less than 40% with PCI, the patient may go back to driving after a month. On the other hand, if the patient had no PCI and had an acute coronary syndrome or a heart attack, then they would definitely go back to driving still after a month. Other cases might be after a bypass graft, which would be after a month. After an arrest with ICD, that's usually after 6 months.
Mm-mm.
So it really depends on the case.
Yeah, that's what I got, Doc, from you, is that it really depends, or it's like a case-to-case basis rather.
Yes.
There's no fixed answer for that, but it could be as soon as right after the surgery, depending on the case. Again, not saying that you should drive ahead.
Yeah.
Or is that it could take up to 6 months, depending on the instructions from your healthcare professional. And aside from driving, Doc, is that they're also asking because patients would really like to eat. Are there some restrictions regarding their diet? Like, are they not allowed to eat fatty, salty, or oily foods? Or that would really depend on their counseling.
Okay, so a lot of times, well, definitely patients will have dietary restrictions. So especially for cardiovascular patients, patients who've had a history of dyslipidemia or high cholesterols and hypertension and even heart failure. So these patients may need a low salt, low cholesterol, low fat diet. And the good thing about the cardiac rehabilitation program is we actually coordinate with the nutrition and dietary department. We refer the patients to them so they can have a more comprehensive discussion about what they can and cannot eat, what the limitations are. We do say that they can occasionally have a little bit of the bowel things, but a little bit, very occasionally, just so that they can have a happy life still. The good thing about the cardiac rehabilitation program is we automatically refer the patients to the nutrition and dietary department for counseling. And this is because during the initial phase, they might not be as receptive to new knowledge yet because of depression or anxiety. And then during the phase 2 cardiac rehab, we do it again just to reinforce whatever was taught to them during the initial phase. And just in case if the patient have not undergone phase 1 cardiac rehab, then phase 2 is still a perfect opportunity for them to learn new knowledge about dietary adjustments for them.
I really like, Doc, what you said, that you're also giving leeway to those foods that are you've classified as bawal, because I know a lot of patients they would really request if they could eat this. There are other doctors that they would just give a leeway that yes, you can eat this just on this day or just this amount, because we're also trying to help them cope up with their anxiety or depression, and we wouldn't really want that for them, because it could affect their progress towards recovery, Doc. No. Aside from the going back to driving, Doc, on what to eat, other patients have also been open about to doing intimate time with their partners. So I'd also like to ask, Doc, like, how soon can they go back to it, and is there a chance that or for a recurrence rather?
Okay, so you have to understand that during intimate activities, there will also be physiologic changes in the human body, and this includes increase in the blood pressure, increase in the heart rate, which might not be, and for which these things will be enough for any normal person. They can their bodies can cope with that. But for patients who've had, let's say, a heart failure, they might not be able to have an adequate cardiac contractility to respond to that level of activity. They might have an inappropriate heart rate response for it. So we usually give a time, or we have signals as to when the patient can resume having intimate activities. So for example, if the patient had a heart attack, usually it takes around 4 to 6 weeks before the patient can resume having intimate activities. And it doesn't matter if they've had revascularization or not, but another clue for them after 4 to 6 weeks is if they can already climb 2 flights of stairs without chest pain, palpitations, or dyspnea, or let's say shortness of breath, or if they can do brisk walking for 1 kilometer without those symptoms, then they are most probably ready. And the minimum metabolic equivalent, or METs, required for that patient, for that activity, is around 4 METs.
So I understand that, Doc. So because I know there are some patients who just really love their partners and they just couldn't help themselves from it. And that's why I asked Pod. Okay, they were also very keen on that regard. Like they would really like to get back onto it.
But on the downside, there are also some partners who would also not allow their patients to do there are some partners who would not allow the patients to do intimate activities anymore because they're afraid for the patient. So, cardiac rehabilitation can also help offer or reassurance to the patients that just because they've had a heart attack or a cardiac condition, it doesn't mean intimacy will be over for them. There's still hope.
You've heard that from Doc himself. There is still hope for you guys.
Yes.
It's not really how do you call it, like a death sentence, that just because you had your operation or you're on cardiac rehab doesn't mean that you can go back to your daily lives, like doing normal activities rather, Doc, no? But that you would just have to take time in terms of the progress of your recovery.
Because the ultimate goal of cardiac rehabilitation is not just secondary disease prevention or to prevent the recurrence of cardiovascular disease, but ultimately to improve the quality of life of the patient. So it, like I said, it's a holistic program. So it's not just about preventing cardiac disease, it's building up the patient to be stronger again, for the building up the patient's cardiovascular system or the cardiovascular function to be more able to cope to physical activities. And also definitely in the long run, because cardiac rehab exercises also includes strength training apart from cardiorespiratory exercise training, there will definitely be an improvement in the quality of life. Strength training is very important for patients, for the patient's quality of life, especially as we get older. We need a good muscular tone, and regular strength training also improves the bone density.
Yeah, because if I'm not mistaken, Doc, correct me if I'm wrong, as you get older, our bones get weaker. Am I
Yes.
correct, Doc? So
Yes.
we really do have to have that strength training, right, Doc?
Yes. And you might be wondering about other benefits of cardiorespiratory exercise for especially patients who have not undergone revascularization. You wonder also what's the benefit of cardiac rehab in a patient with heart failure, but this patient did not undergo a bypass graft or a PCI. So with regular cardiorespiratory training, it eventually improves gas exchange, okay, between the heart and the lungs. So aside from that, the heart will eventually make collateral arteries to supply areas with less perfusion. So this is a natural response, but of course there's no way in saying how fast collateral arteries may grow. But this is one of the things that we are pushing to make for these patients with heart failure. And also with regular cardiorespiratory training, the peripheral muscles will eventually form more mitochondria. And as you know, mitochondria are the parts of the cells responsible for creating more energy. So having more mitochondria actually makes movement more energy efficient. So this ultimately benefits heart failure patients.
And I'd like to go back on what you said, Doc, because as we all know, it's really one of those topics that would really leave a person's mind, is that the mitochondria is a powerhouse of the cell.
Yes.
And that you're right, Doc, and that more mitochondria means that we are much more energy efficient, meaning we could do a lot more or cover a lot more activities than usual. Doc, I would just also like to ask, because there are people who would really self-diagnose or self-prescribe themselves, like they would be using different social media platforms, search engines, or even use AI. So I would just like to ask for your advice to our viewers who are watching right now.
Okay, so that's an excellent question, and it's very applicable to the people of today. So the internet and the search engines, AI, they're all excellent sources of knowledge. They can be used for inquiries. However, you should always remember that each medical condition is different it's unique to each individual. So you should follow up with your physician for a more tapered or tailored care program. So it doesn't mean that because you'd read about heart attack and heart failure that everything on social media is applicable to you. And you should also be careful with social media, because there are a lot of times when non-healthcare professionals would throw in unsolicited advices, and these advices might be more harmful to you than it should do good. That's all.
That's really true, Doc, because I've also seen on different platforms that there are people who would be posing themselves as healthcare professionals. They would be giving out advice like, you should take this, you shouldn't do that, you should do this. And it's really a battle of accurate information versus mis or disinformation, rather.
Yes. So I also see this a lot in social media. But apart from social media, this is also seen in a lot of situations in which neighbors, family members, relatives might also give unsolicited advices to patients. And a lot of times the patients might also be harmed by such advices. So always follow up with your doctor and follow your medical advices.
So that's it. If you have any questions or if you have symptoms, it's better to consult your doctor or seek a healthcare professional in that regard. Before we end today's podcast, I would just like to ask you, Doc, what is your message to our viewers who are watching right now with regards to cardiac rehabilitation?
Okay, so life doesn't end after a cardiovascular disease, and cardiac rehabilitation is an excellent program to enable the patients to have knowledge about secondary risk reduction and to have the healthy lifestyle behaviors and changes to make in order to have a healthy heart, and also, of course, to be stronger with a medically supervised exercise training program.
Thank you so much, Dr. Nuiko. I really appreciate
You're welcome.
for you.
Thank you for having me.
I really appreciate you having the time to sit down with us and talk about cardiac rehabilitation. Should you have any more further inquiries, you could contact our local directory 4202000 or local 7599. Or if you would like to take a visit with their office or their unit, you could just visit the 4th floor medical specialty building. They're open from Mondays to Saturdays from 8 a.m. to 5 p.m. Once again, my name is Nigel. I've been your host for today's episode of Paging SUMC. And tune in for next episode. And please follow our official Facebook page at Silliman University Medical Center.